Welcome Home, a podcast for veterans, about veterans by veterans, is a project of Willing Warriors and the Warrior Retreat at Bull Run.
Good morning. I'm Larry Ziliak, Director of Culinary Services here at the Warrior Retreat at Bull Run. And this week, our guest is Dr. Matthew Reinhard. He is the director of the Complex Exposure Threat Center of Excellence at the VA in Washington, D.C. And I'm really happy that he's able to join us today because I really want to explore some of the research that the VA does. And of course, our listeners are very familiar with all the health benefits and claims and getting medical help from the VA. I'm not sure that many of them understand really how much research the VA does or funds that goes into supporting our veterans with medical health issues. So, Dr. Reinhard, thank you for joining us.
Well, thanks for having me. It's great. I don't really usually get to do this kind of thing. So hopefully I can information you're looking for.
Yeah, I'm sure you'll be able to. I've looked at your resume there, and I've been on the webpage for the center, and it's you seem like the guy who can handle all my questions. That's for sure. If we could start with, just tell us a little bit about your background and how you became involved with the VA and the center.
Wow, sure. I don't think anyone's ever asked me that, but so I've been the director for something called the War-Related Illness and Injury Study Center, with the acronym there is RISC. And now there's a sub-center within that, the Complex Exposure Threat Center of Excellence, or STETC. I guess I'll refer to them as RISC and STETC from this point forward. My training was as a neuropsychologist, and I took a role coming out of graduate school as a neuropsychologist at the RISC. And later, after a few short years, I ended up running that study center or becoming director for it. But I think, how I got to the VA originally, my interest in the VA, my dad is a veteran, my grandfather as well, relevant and important to me. I think, our family history is involved in service. And my dad was, during the 1950s in the Army. And so it always was in my mindset to, provide service in some way. I was not in the military myself, but I think being a civil servant with the VA, which really has the greatest mission that you could possibly have, which is, to care for veterans, makes a lot of sense to me. Always made a lot of sense to me. And I've been fortunate enough to, have success and get into graduate schools and then do all the studying and get to get positions, and then, achieve through those positions some leadership roles in a really kind of dynamic center or centers that we have now.
So tell us a little bit about the center and what really distinguishes the Center of Excellence from your just run-of-the-mill garden variety center?
That's a good question. All right, so I think I'll talk about the SETC because that's what you started with. So a Center of Excellence, what that essentially means is you've got a concentration of expertise. And in our case, it's really an interdisciplinary expertise, specifically with military exposures and veteran health. Mm-hmm. And that is not easy to do. You kind of have to hire, and recruit the right people. And we're a small center. We're not a big group. And really, the risk or the War-Related Illness and Injury Study Center is the major support. But yeah, we've been able to recruit really some of the finest occupational and environmental medicine physicians that had long military careers, in medicine throughout the military and leadership roles in the military, who are also clinical providers. And so we've been able to hire a few people there, and that allows us probably, because there's just not that many people like that, that allows us to have probably that's, even though it's just a few folks, it's probably the highest concentration working together towards, some of the questions and issues that we think are important for veterans, present and then going. forward into the future. I hope that answers your question about what I think a center of excellence is different. There's some technical stuff as well. Like, you have to maintain that excellence, and that's measured, every 5 years. There's sort of a look at how that's going, and measuring success. And I think that's important as well.
And so is there elevated funding involved when you kind of shift over to the center of excellence? That's a question that remains to be determined. I actually don't know. That's probably above my pay grade. We'll keep
I can't comment on that.
We'll keep our fingers crossed.
Yeah, it'd be great.
So, talk about the team, if you would. So I think our listeners need to understand that it's not like you're all in a little building down in D.C. When you talk about the team, I think you're talking about bringing people on board that are part of other academic institutions and things like that contribute and support the center. Is that kind of like what it is?
Sort of. Yeah. I mean, I think we've got certainly some of the occupational and environmental medicine physicians, which are kind of with military experience and careers, and there's not that many of those, and so we've got a few there who are really premier people. There's a multidisciplinary team. Obviously I'm a neuropsychologist by training, but now I'm more sort of in a leadership role. But we have neuropsychologists and a nurse practitioner and social work. We also have, I should add, all these people sort of have an expertise in environmental exposure, because that's something that's sort of unique to military service, and then thereby, veteran care. So, and that's something sort of unique to the VA. I can go into a little bit about that as well. But we have multidisciplinary staff. We also have academic partners with. It might be with grants that we're writing or working with that we're trying to, because we do compete for funding, like everybody else to try to bring in additional studies and grants. And, our area of focus is usually on environmental type exposures or military type exposures, and health outcomes is really, because again, so getting back to that center of excellence concept. And so that's kind of where we focus. And so you need partners there. We're never going to have all the expertise in-house. And I don't think that's the way it should be, right? You have to partner and make friends, in academic institutions, but also in other federal agencies, actually. Mm-hmm. And so that's something that isn't often done, but that, spending the time and energy to sort of partner with other federal agencies, I think is key, especially for the SETC, because the role there is, it's got a few key roles, but one of them is, as we talked about sort of this environmental exposure concept, so people who serve in the military are exposed to things that we're not often going to see like in a civilian context. And so that's why, a few like airborne hazards or burn pit smoke and things like that, depleted uranium or unique solvent exposures or weapons systems, or subconcussive blasts, repetitive subconcussive blasts, all these. And then, of course, there are new and emerging things as warfare likely is changing, as we can sort of see and observe. Mm-hmm. And VA needs to be educated in some ways and be prepared as a healthcare organization for what's coming, not just necessarily responding to things, many decades down the line. So that requires those connections with other federal agencies. And one of the roles of SETC that I think is unique is it's thinking about those emerging issues. And so there's an education component, as we meet and talk with other people and agencies and find out things. Then, can we prepare education modules for our own healthcare system to be prepared? Yes, that's something that only the VA can do, or has done, I should say, because that's not really a civilian healthcare system focus. That's something, and I think that's why veterans, many veterans, are happy with their VA care, and because there really is that emphasis on some of the unique, military-related exposures. And I think VA is becoming more and more aware of that. And I think SETC and the risks plays a role in uncovering that stuff and also, educating our own system.
Yeah.
Because if you ask veterans, this is another thing that, probably wouldn't happen in the civilian sector, but if you ask veterans about their concerns, and do you have concerns about things that you may have been exposed to when you were deployed or in training or on this or that base or wherever you might have been, they will tell you, about their concerns. Yes, I am, these alarms did go off and I put on a mop suit and I'm worried about, or yes, I was exposed to this solvent when we did this task, and, people, so there, as you start to ask and get people's stories, you will hear that they have health concerns and sort of long-term, what are the long-term effects of these things? And that's going to be a VA area of interest, right?
Yeah.
It's important.
So one of the things that jumped out at me when I read sort of the press release on the center a few months ago is that it was so forward-thinking that, as you said, sometimes the VA is a little slow to catch up with things, and I get that. It's always a funding issue. It's can't look at things until it's a real problem. But this sort of jumped out at me because it seemed like, hey, somebody's sitting down and saying, we've got all this stuff going on and all of our service members are exposed to these things. Maybe we should take a look at the impact of those things on our service members and maybe get ahead of it and say, this could be a problem, so we need to handle it this way. I want to direct our listeners to a previous episode that we did in Season 2 back in February of 2024. It's episode 6 of Season 2. And that was an interview with Dr. James Stone, who's a researcher at UVA. And he is researching the effects of low-level blasts on and TBI on EOD instructors. And it was very, very informative. And it's sort of one of the kind of things that I see the center funding or getting involved with. And I just can't get over the fact that somebody at VA said, we need to take a look at these things that are affecting our members in the future. I guess one of the questions that I have is that I know you all are new. Well, actually, the center's been around since 2022, but as a center of excellence, which I'm assuming meant you brought more people on and things like that. What is the process for uncovering things that you may need to look at and then deciding on what you should look at?
Wow, that's a good question. First of all, I got to listen to the James Stone episode. We do, you mentioned, I think what you were talking about there was probably subconcussive blast. And I think you said EOD.
Yeah.
Did you say EOD? Yeah. So explosive ordnance disposal. We have a specialized focus in EOD as an occupational group. One of the things we're interested in is, and this is getting to your real question about process. That is an example of a group that we identified as likely high exposure. So they're going to have high exposure to, whether it be blasts, obviously, it's a explosive ordnance group, chemicals, stress, novel weapons systems, all those things. And so how do we identify that group? You believe it or not, I received a written letter from a veteran years ago, and it was an EOD veteran, and he was concerned about the health and wellness of his colleagues. And I called him back. He had his phone number there, and I called him back and started a conversation. And then a lot of our programs, in some ways, start with very with things you wouldn't think of, But what I think it says is that we're kind of listening to the veterans themselves. And so we spend a lot of time doing that. We hear it's a little bit of a surveillance mode also because, we see patients clinically. So we bring in a few patients, sort of the higher exposure type patients, and we listen to them. And it's kind of a surveillance mode in that way from a clinical surveillance sort of model where you're like, wow, this person's talking about something that we hadn't thought of. We need to look into this further. Like, how many people are there like this? What do we need to do? And so it kind of is very organic in that way. There are times where it's not necessarily organic from coming, like I would call that a grassroots process, which, that was a good example of it. We have, there's an on high process too, where one of the higher ups will say like, we need to check this out. And I don't know, how those things necessarily come to them, but I can't say. But, there are cases where, there are cohorts of interest that we need to look at further, and probably for very good reason. There's lots of different ways. And of course, we continue to be out and about and talking to other investigators and researchers and clinicians. The center is like a translational center. So it means that we translate our clinical experiences into, research ideas as well as educational, products. And those things then serve the system back and influence clinical care. So it's like a big circle. And so I really, as part of what I've done there is to sort of really reinforce this translational center, like, to tell everybody, this is who we are. This is what we do. This is why we need to hire people with clinical training that also have interest in studying things a little bit further. But we also need, this gets back to a previous question of yours about our team, we also need to have people who really focus on research, because that takes a lot of time and effort. And we need people that understand computational modeling, which isn't me, but, there are people that know how to do that, and epidemiologists. And we need, if we can't have all that in-house, we have to partner with others as well. Hopefully that explains the process.
Yeah, I will send you a link to Dr. Stone's episode. It was fascinating because they had started their research looking at the effects of tier 1 door kicking operators, thinking, well, they're exposed to these large blasts and constantly. And then the EOD instructors asked to be part of it. And it turned out that being subjected to the lower level, the sub-level explosions on a more regular basis seemed to have more of an impact. It was really interesting. What is the center's focus right now? What would you say is the number one thing that you're looking at as a center for environmental exposures of what our service members are going through or may be exposed to today?
Well, it's interesting. Right now, you were right before when you said it's a new center. We are. We're kind of young. There are cohorts of interest, or I would say, let me back up, occupations of interest. And so EOD, as we just talked about, is a major interest of ours. We've already learned a lot. We have the only center in VA really focused on that group. I've seen a lot of the veteran patients myself and with the team, and we've learned a lot. And we're developing, a research program. We're seeing folks clinically right now. And that sort of, again, gets back to this translational model. Like what can we glean from the clinical care, and what are questions that need to be answered? And so we're developing a research project with a partner. In this case, it's the University of Maryland over here at College Park over in Maryland here. And that's really to look at the biological wear and tear of, military exposures, with that group. And I think we will add additional occupations of interest, I'd say. And like kind of wanting to understand probably what Dr. Stone was talking about, but, how the cumulative military exposures, not just blasts, other exposures that people often aren't considering, whether it be chemical, or, obviously consider sort of stress exposures and things like that. But there may be toxin and chemical exposures as well that often, researchers aren't thinking about. And so how those things cumulatively may impact, health outcomes. And so we're working with University of Maryland on this concept of allostatic load, which is basically, the cumulative effect of stressors on the body. causing physiological changes. Because, a lot of the patients I'm seeing really are, some of them are having a lot of difficulties, and it's hard for us to always, measure and conceptualize, with our instruments or, and I'm a neuropsychologist, so I think sort of measuring cognition, our measurements of cognition don't always match up with, people's self-report of what they're saying that their difficulties are. And so I'm trying to think about different ways in which the cumulative effects of their experiences lead to disease and stress on the body.
Yeah.
So that's an ongoing thing. I'm kind of excited about it because we're sort of finishing up, some dry runs just with our own staff to sort of, be able to enroll participants. Although I'm not really advertising it yet, but we're getting there with that. And so that's one occupational group. There are other things I can talk about as well, but that would be one example.
Yeah.
Right now.
Well, I will say that this it kind of hits home for me in my service. I was Air Force, and I was in from 77 to 83. The first duty station was Loring Air Force in northern Maine. And I remember one night I was in the weapons storage area, and I was on a two-man patrol just sitting around, and the sergeant I was with was a real knucklehead. And he said, "Hey, come on over here. I got to show you what I found." And we went over to this pipe that was sticking out of the ground. And he said, "Look, the top of it is loose." And he swung the top of it around. I'm like, okay. And we were just standing there, and he pushed the top back on. And I said, maybe we should tell somebody. He said, no. Well, probably within 20 minutes, we were both really sick. And we went to, we went to the hospital, and they took us in. It kept us overnight, and they said, "Well, you seem to be okay." And then they sent us home and went back to the barracks, and that was the end of that. And it wasn't, my next duty assignment was Guam, and I got to thinking, I wonder what made me sick. And I actually stumbled upon the environmental safety office that the Air Force had there in Guam. And I walked in and I said, "Hey, this happened to me. I can't figure out what it was." And the very nice officer, I think he was a captain at the time, I don't remember his name. He said, "Well, let me look into it." And it took months and months and months to get an answer. And finally they came back and said, "Oh, well, that was something that led to some heavy water, which I had never heard of." And they said, "You probably inhaled that, and that's what made you sick." And I just think, I was just an Air Force cop, sitting around on a patrol in a weapons storage area. And it just makes me think that you can be on duty just about anywhere in the military and be exposed to all sorts of things. I really appreciate the fact that the VA and you and your staff and everyone there is thinking about this when no one else really was. And it's an amazing service that you provide. And I think it's also important for our listeners and folks to know how much research the VA really does. It's not just a hospital somewhere where they treat you when you come in and, just treat your symptoms and send you home. There's a lot more that goes into the VA, and it's why it has such a large budget. It's also why you need more money. And I encourage all our listeners to make a claim and sign up. And even if you get a 0 rating, that's one more body that the VA has to deal with. And hopefully Congress will give them more funding for not only benefits, but for research like this. So as we kind of wrap up here, I really appreciate everything that you've told us about the center. I do have one last question for you, and it has to do with artificial intelligence. And how do you think AI will affect the work that you do?
That's interesting. I guess I can answer that on a couple levels. I don't, I think AI right now is used for assisting writing. I don't use it, but I think as it advances, it probably will help providers synthesize complex medical records and this is not in place yet, but I could see a not too distant future where it really synthesizes for, let's say, a physician in this case, although I'm not a physician. Let's say a physician, someone's medical records from the DOD and the VA over decades, and it could maybe distill down and capture, many, many thousands of pages of information.
Mm-hmm.
To then sort of suggest to the doc, here's some point to maybe ask about or look at, and here's some recommendations. Not so much as taking place of the physician, because they have you can't really replace that, I don't think. Mm-hmm. But as an assistant, I could see that happen. I think that is happening in some places already. I'm not sure about the DA, but I could see that being a real benefit to patients. Mm. Because we actually in the risk and safety do very deep dives into patients' medical records, but that takes like human man hours and woman hours, and I could see if there were a tool that was really much better at that, sort of natural language processing and all this kind of stuff that could model some of those things and come up with suggestions. I could see that being a real help sort of in the short term for healthcare.
Yeah.
That's the first thing that comes to mind. Yeah.
Well, that's great. Well, listen, Doc, thanks so much for joining us and taking your time to tell our listeners about the center, and we wish you all the luck. And I've got fingers crossed for much more funding for you. And
all right, up for that.
Hopefully you'll see an increase in that soon. And listen, keep up the great work. I really appreciate it.
Well, thanks for this opportunity and your interest. Not often I get to be able to talk about the things that we're doing, and it's really not. I've talked about the team and this group here, but it's really not me. We have a very, very good group of scientists and clinical providers here, and as well as our leadership has been really, really good. So I feel very fortunate to work for VA. And with the mission that it has. So thank you.
Yeah. For our listeners, if you have any questions or suggestions, you can reach us at podcast@willingwarriors.org. We'll have another episode next Monday morning at 0500. Until then, thanks for listening.
The Welcome Home podcast is brought to you by Willing Warriors, a nonprofit organization serving active duty service members and veterans since 2012. To learn more, please visit our webpage at willingwarriors.org.